So the testing process actually first begins with screening. So we'll have screening questions to determine whether or not we actually would do the nasopharyngeal swab on a person. And with that, we ask what if they're having any symptoms, and if no symptoms, have they been traveling? Do they have a known contact who has been diagnosed or tested for COVID-19? Or if they are an immunosuppressed person and having any symptoms. I think you can probably see in the back there that our safety precautions are quite extensive. We are following the CDC guidelines for a respiratory and potentially a droplet-borne and potentially respiratory spread infectious disease. And so we have the masks, the goggles, the protective wear, and of course the ever-present gloves. Why this drive-through is so important to the community. The reason this is so important is, as you know, I think that it's been well discussed in the media, this is something that is easily spread from person to person, and it can be spread before you actually have symptoms, which is why we also do those additional screening questions to determine who else may be tested, even if you don't have symptoms, if you've been a contact, if you've traveled outside of the country. And the reason that this testing center is so important is because we really urge people not to go to the emergency department for this. It uses up valuable resources, which as this progresses, if it does progress, it's going to be using up much more of the hospital facility. And then also the health department here is really set up for seniors and for children, mothers who are pregnant, and that is not a good place to go either. So we don't do testing at the health department, and we want to keep our healthcare facility as the emergency department open for more emergent things. With 80% of COVID-19 being something similar to a cold, you can usually stay at home with this. But you do need to know if you have it so you don't infect others. So this is perfect to be able to drive through, get tested, and then the results will depend on which category you fit into for testing.